What is cocaine? Cocaine is a powerfully addictive stimulant drug made from the leaves of the coca plant native to South America. Although health care providers can use it for valid medical purposes, such as local anesthesia for some surgeries, recreational cocaine use is illegal. As a street drug, cocaine looks like a fine, white, crystal powder. Street dealers often mix it with things like cornstarch, talcum powder, or flour to increase profits. They may also mix it with other drugs such as the stimulant amphetamine, or synthetic opioids, including fentanyl. Adding synthetic opioids to cocaine is especially risky when people using cocaine don't realize it contains this dangerous additive. Increasing numbers of overdose deaths among cocaine users might be related to this tampered cocaine. Popular nicknames for cocaine include blow coke, crack rock, snow. How do people use cocaine? People snort cocaine powder through the nose, or they rub it into their gums. Others dissolve the powder and inject it into the bloodstream. Some people inject a combination of cocaine and heroin, called a speedball. People who use cocaine often take it in binges, taking the drug repeatedly within a short time, at increasingly higher doses, to maintain their high. How does cocaine affect the brain? Cocaine increases levels of the natural chemical messenger dopamine in brain circuits related to the control of movement and reward. Normally, dopamine recycles back into the cell that released it, shutting off the signal between nerve cells. However, cocaine prevents dopamine from being recycled, causing large amounts to build up in the space between two nerve cells, stopping their normal communication. This flood of dopamine in the brain's reward circuit strongly reinforces drug-taking behaviors, because the reward circuit eventually adapts to the excess of dopamine caused by cocaine, and becomes less sensitive to it. As a result, people take stronger and more frequent doses in an attempt to feel the same high, and to obtain relief from withdrawal. Short-term effects. Short-term health effects of cocaine include extreme happiness and energy, mental alertness, hypersensitivity to sight, sound, and touch, irritability, paranoia, extreme and unreasonable distrust of others. Some people find that cocaine helps them perform simple physical and mental tasks more quickly, although others experience the opposite effect. Large amounts of cocaine can lead to bizarre, unpredictable, and violent behavior. Cocaine's effects appear almost immediately and disappear within a few minutes to an hour. How long the effects last and how intense they are depend on the method of use. Injecting or smoking cocaine produces a quicker and stronger but shorter lasting high than snorting. The high from snorting cocaine may last 15 to 30 minutes. The high from smoking may last 5 to 10 minutes. What are the other health effects of cocaine use? Other health effects of cocaine use include constricted blood vessels, dilated pupils, nausea, raised body temperature and blood pressure, fast or irregular heartbeat, tremors and muscle twitches, restlessness. Long-term effects. Some long-term health effects of cocaine depend on the method of use and include the following: snorting, loss of smell, nosebleeds, frequent runny nose, and problems with swallowing, smoking, cough, asthma, respiratory distress, and higher risk of infections like pneumonia, consuming by mouth, severe bowel decay from reduced blood flow, needle injection, higher risk for contracting HIV, hepatitis C, and other bloodborne diseases, skin or soft tissue infections, as well as scarring or collapsed veins. However, even people involved with non-needle cocaine use place themselves at a risk for HIV because cocaine impairs judgment, which can lead to risky sexual behavior with infected partners. See cocaine, HIV, and hepatitis. Other long-term effects of cocaine use include being malnourished, because cocaine decreases appetite, and movement disorders, including Parkinson's disease, which may occur after many years of use. In addition, people report irritability and restlessness from cocaine binges, and some also experience severe paranoia, in which they lose touch with reality and have auditory hallucinations, hearing noises that aren't real. How does cocaine use lead to addiction? As with other drugs, repeated use of cocaine can cause long-term changes in the brain's reward circuit and other brain systems, which may lead to addiction. The reward circuit eventually adapts to the extra dopamine caused by the drug, becoming steadily less sensitive to it. As a result, people take stronger and more frequent doses to feel the same high they did initially and to obtain relief from withdrawal. Withdrawal symptoms include depression, fatigue, increased appetite, unpleasant dreams, and insomnia, slowed thinking. Other short-term effects of cocaine may include Extreme sensitivity to touch, sound, and sight, intense happiness, anger, irritability, paranoid feeling, decreased appetite. People who use cocaine often may also have more serious side effects and health problems, like headaches, convulsions and seizures, heart disease, heart attack, and stroke, mood problems, sexual trouble, lung damage, HIV or hepatitis if you inject it, bowel decay if you swallow it, loss of smell, nosebleeds, runny nose, and trouble swallowing. If you snort it, you may have strong cravings for the drug and the high it brings. But the more you use cocaine, the more your brain will adapt to it. You'll need a stronger dose to feel the same high. This can lead to a dangerous addiction or overdose. Stronger, more frequent doses can also cause long-term changes in your brain's chemistry. Your body and mind begin to rely on the drug. This can make it harder for you to think, sleep, and recall things from memory. Your reaction time may be slower. And you're at risk for more heart, stomach, and lung problems. Thanks for watching. Hope you like this video. If you are new to my channel, please subscribe to my channel and don't forget to like and comment.